All right. Hi, everyone. Welcome back. So today we're talking about a part 2 of hypertension. So on this part 2 video, we are going to be speaking about the complications of hypertension. So in part 1, we defined hypertension. We talked about the risk factors. We talked about the stages of hypertension. We talked about causes of hypertension. But today we would continue speaking on hypertension, but really focusing on the complications of hypertension as well as the treatment of hypertension. We would also round up this video talking about hypertension during pregnancy. So stay tuned. Let's get started. All right, welcome back. So today we're finishing up with hypertension. But if you have any question, of course, please do mention it at the end of this video, and I would be very glad to answer your questions and concerns. So, like I mentioned briefly in the previous video, that the complications of hypertension impacts the entire body from head to toe. It really does. Now let's talk about the brain. Since we're going in a chronological order, let's start with the brain, correct? So in the brain, what hypertension does is, over the years, due to wear and tear, the elasticity of the vessels of the artery have become weakened. And so if that patient who has naturally obtained or going through wear and tear of the arteries has high blood pressure on top of a natural aging process of the artery, it makes this patient very vulnerable to have an aneurysm in the brain. All right. What is an aneurysm? An aneurysm is a rupture of a blood vessel or rupture of something. All right. That's called aneurysm. So if you have this wear and tear, okay, now let me use another analogy. Like say there's a balloon and you keep putting water in that balloon and the water stays there for long periods of time. It weakens the walls of the balloon. It weakens it. Eventually, when you keep having fluctuation of this balloon, of the volume of the balloon, eventually one day when you have a fluctuation, the balloon is just going to rupture. It's just going to burst open. So that's how the vessels in the brain respond with patients who have a long history of hypertension that is not properly controlled. All right. And brain aneurysms can kill. But before they kill you, let me tell you what they do. You lose neurological functioning. So say, for instance, a blood vessel or a group of blood vessels in the brain gets ruptured as a result of a long history of hypertension, uncontrolled hypertension. The bleeding pushes, because bleeding is accumulating. Now you have to understand that there's limited space in the skull. You have to understand that the skull does not necessarily enlarge, but the pressure in the skull can enlarge and will enlarge when provoked, right? So when there is bleeding in the skull, it pushes, or in the brain, it pushes the structure towards the inner walls of the skull. And when it's pushing these structures, the signals that the body gets from those structures are impaired. So before your brain is pushed out through something called the herniation of the brain, meaning that the brain is going out of its compartment, right? So if the brain is going out of its compartment, it is pressing against other structures. The instructions or the signals that specific section of the brain is supposed to give to the body is going to be missing. You're going to have paralysis, right? You can have paralysis on one side of the face. You can have sensory loss. You have eye problems, all right? Because things are pushing against other things and instructions are not being properly communicated to the rest of the body. So brain aneurysm, because of hypertension and weakened or bulging blood vessels, it's easy for this cerebral blood vessels to become ruptured. right? And then you also have signs like headaches and vomiting in the process because of increased pressure in the brain, increased intracranial pressure. That's what it's called. So now let's go to the heart. Let's move down, right? Chronological order. Let's move downward. So another effect of hypertension is heart attack. How is heart attack even something we're talking about when we talk about high blood pressure? You know, I mentioned in the previous video that the heart, for whatever reason, for whatever insult, the heart could get damaged or overly stressed. When the heart is overly stressed, for whatever reason, or for the risk factors that we mentioned in the first video, which I would recommend that you watch the first video on hypertension part 1 before you watch this one on part 2, right? So what happens is when the heart is insulted, by insulting I mean when you do something to the body that puts stress on the heart will try to accommodate that stress. And one thing that the heart does to accommodate that stress is by increasing its muscle structure. Now, when it overly increases its muscle structure, it's called cardiomegaly, mega, big, right? But when the size of the heart is increased, it doesn't necessarily mean that the heart is working even better. No, it just means that the heart is really desperate to accommodate the stress that the body is putting on the heart. And if it gets to that point where the cells of the heart are remodeling themselves, that is a problem. That's why some hypertensive medications would increase inhibiting that process, because you remodifying your heart structure is not a good sign. So medications like ACE inhibitors would also gauge towards stopping the heart cells from remodeling. They're stopping the heart cells from trying to take a form that is not natural. All right? And also dilate the blood vessels so that the pressure or the stress is not high. Okay, so when you have this hardening of the heart and thickening of the arteries and then stress, all of these things are effects of hypertension, because the heart is working too hard. Because where is that fluid going to go if the heart does not work overtime because of excess fluid in the body? It's more stress. So when you take salt from your diet, you consume too much salt. Too much salt retains water. Too much water increases the fluid pressure in the body. And now the heart has to work overtime to eliminate some of that fluid. But even at that, the heart is working against a lot of pressure. All of this stress over time can result to heart attack. All right? So heart attack is a consequential effect of a prolonged, uncontrolled history of hypertension. Along that scheme of things, within that arena, you see heart failure. Heart failure is the heart just gives up. It's done being stressed. It works and works and works, tries to accommodate stress, does everything, enlarging itself, everything done. And after a while, it can't work anymore. That's heart failure. The heart is failing to work, to perform its functions. It's done everything it can. So I can't do this anymore. Yeah. It's not just us who say I can't do it anymore. The heart also says that I can't do this anymore. It's too much work, right? You don't want your blood pressure to get to a point where your heart gets to tell you that. No, you would die if your heart gets to tell you I can't do this anymore. So please, control your blood pressure. Take it often. Listen to your physicians. Visit with them often. And let's take care of this problem so that you will have a longer lifespan. All right? Okay. So another thing that we are going to talk about is the weakening of the blood vessels, which we mentioned briefly in the previous video. The weakening of the blood vessels, or the narrowing of the blood vessels in the kidney. That's when the kidney is not receiving enough blood and by not receiving enough blood, it's secreting hormones that would allow the body to retain fluids eventually. And when the body retains fluid, the body becomes high in fluid, and of course that increases pressure. So that's a complication. A complication could be of a stenosis, a kidney problem, a kidney disease, right? Or say if you only have one kidney, for instance, you give one away, or one was taken out because of a disease or something. You only have one kidney, now the pressure on that kidney is high. All right, so it is highly probable that that one kidney that you have is going to go through tremendous stress, but their diet, their ways of avoiding this, or at least slowing down the stress, or reducing the stress on one kidney. All right, so when there are kidney problems, we see that, and all of this again could be complications of hypertension, a long history of hypertension. So we see thickening and narrowing or tone of blood vessels in the eye. We see this a lot in people who do not only have a history of hypertension, but people who also have a history of hyperlipidemia, meaning your lipid panel is abnormally high. When I say lipid, I mean fat, right? Cholesterol, you're high in cholesterol, right? When you're high on cholesterol, your lipid levels are high. When you're high on sugar, these people usually also have a history of diabetes mellitus. Type 1 or type 2, but usually type 2, all right? Because like we mentioned, type 1 is usually at a young age and all whatnot, but type 2 is eventually down the line over time, in a more mature adult. So people with a history of hypertension and you see eye problems, they usually have hypertension with diabetes mellitus and hyperlipidemia, high cholesterol. The high cholesterol, what happens is these plaques, the high cholesterol creates plaques in the vessels, which is also a contributing factor, or is something that you also see in a heart attack. In the case of a heart attack, besides hypertension, they also have a history of high sugar, right? Diabetes mellitus and hyperlipidemia, where these plaques go and narrow the vessels. And we know how narrowing of the blood vessel, especially in the kidney, how it really negatively impacts the human body in terms of fluid control. So these plaques goes and narrows the blood vessels. Could be any part of the body, but also the eye. And then there's back pressure. So if there's narrowing and there's a certain amount of fluid that has to go through, right? If it has to go through and there's narrowing, there's backed up pressure. It's like you're opening a pipe and you're trying to wash your car or water the lawn, right? And then you squeeze on that pipe at some point, right? You squeeze on it at some point. You see that the rest of the pipe, the water backs up and the size of the pipe increases, correct? So when it increases, now of course, as it's increasing in the human body, especially in the brain, like I said, there's limited room in there. As that back pressure is increasing, it's pressing against other structures, right? And as it's pressing against other structures, it can damage. It could press against a nerve. It presses against an artery. It presses against a vein. It presses against something. If it presses against a nerve, you're not getting a certain kind of signal. The eye is not receiving some kind of instruction, and then if they say look up, you can't look up, or look down, you can't look down, or say look sideways. No, you can't, because that nerve is pressed against the wall of other structures, because the narrowing that allows the flow, the free flow of fluid, that structure is narrow, that vessel is narrow, and that results to eye problems, all of which precipitates from hypertension. Hypertension is not a joke, people. It's not. So if you don't take your medicine, you will have eye problems. You will have brain problems, aneurysms, kidney problems, heart problems. You will. So you have to take your medicines. You really do. Okay? So you if it expands so much, the vessels in the eye, the backdoor pressure is expanded so much, it could tear it. When it tears it, it leaks through to other structures around it. And that's not good. It damages messages to the eye. And that's how you could lose your vision because of an uncontrolled history of hypertension. So please pay attention. Okay? Now, while we're talking about the brain, let's finish up and then. Okay? So let's say there's the blood pressure in the brain was so high that it ruptured the blood vessel and there's bleeding, intracranial bleeding, and the bleeding is really pushing the rest of the brain to one side because there's too much blood. I mean, the skull is not going to expand. The skull is not elastic. It's a bone, right? It stays that structure. It's only in children where, because the skull is still fusing, right? You can see intracranial pressure. You see the head size, the head circumference of the baby. When you measure it, it's enlarging. When you see that, because the bones are not as rigid as it is in adult, and it's in some cases it's not fused yet, right? You need to give the baby some time to mature for the brain to fuse. So in children, when there's increased intracranial pressure, you actually see the head size increases as well. But in adults, you really don't see that much. You really don't, because the size, it's already, I mean, it's what it is at that point, right? So, but what you see is, you see headaches and other signs to let you know that the pressure in the brain it's beyond what it's supposed to be, right? You see headaches, you see eye problems, you see sensory loss, right? Because the structures are pushing against other structure. They are herniating, right? They are going into outside of their compartments, all right? So that's what we see. And when that happens, perhaps the part of the brain that helps with remembering or understanding or communication, right? Those parts of the brain that helps with articulation, if they are pushed against out of their compartment by bleeding due to hypertension, that person will have dementia. Dementia in this scenario is called vascular dementia, because the blood vessels are ruptured and they're pressing against other structures. You have impaired memory, impaired understanding, because it's not functioning the way it ought to, because structures are pushed into different compartments. All right, they're leaking into other compartments. So you see that you can really lose your mind in terms of like your psyche because of hypertension. All right, you can do all of these things, or you experience all of these things. So what do you do when this is a problem? How do you treat hypertension? How do you avoid hypertension? Number one, your diet modification, just like in diabetes. Before you try pharmacological help, lifestyle modification. Now I know us people of color, we like a lot of bouillon, of chicken bouillon in our meals to give it flavors, which is good. I mean, it makes the food tasty, but you don't want to use too much salt. All right, you don't want to use too much salt in your cooking. Use seasoning, more of seasoning than just iodine salt, for instance. All right, by that I mean inhibit or reduce your salt intake. When you reduce that, remember the definition. Remember what I told you in the first video. Salt retention, too much salt consumption result to salt retention in the cells, and salt retention in the cells result to water retention in the cells and the rest of the body, and that puts pressure on your heart, right? And that's how heart failure, heart attack could very easily be as a result of hypertension, because originating from your diet. So Do pay attention to the things you ingest, okay? You also want to manage stress. You want to try to not be, abstain from stressful situations. Mhm. It's hard to obtain from stressful situation considering our society today, right? But try, really do try, because this is your health we're talking about, okay? Try to abstain from stressful situation, because what stress does is stress stimulates the production of certain hormones, and these hormones, they do not, these hormones slow down digestion, and then you put on weight, right? Like cortisol, right? You put on weight, you're not digesting things. So you see that when I talk about diabetes, hypertension, hypercholesterol, which I will get to later, you see that they are all intertwined with each other. They're all intertwined with each other, and they impact us very similarly. And that's why when you see a patient with diabetes, the next thing I expect to see is hypertension, because they work hand in hand. The next thing, if I see a patient with diabetes, I'm expecting to see hypercholesterol. I'm expecting to see high cholesterol, hypertension, high blood sugar. So all these high mixed together is a very detrimental cocktail of medical complications. All right. So your diet, exercise, remove stress. When you exercise, sometimes you burn away stress. Yeah, you do. You really do. When I'm really stressed, sometimes I go exercising. I do. I really do. I really do. So it's not just eating right, it's also exercising. All right. Because when you also perspire, you're sweating. For those of you who have high salt content, if you taste the sweat, it is quite salty. So you see how you eliminate salt from your body through exercise as well. You're eliminating fluid through sweating, and fluid goes out with salt. So exercise and that, and low salt consumption, okay? And low, and less carbohydrate too, because we said a risk factor for hypertension was obesity and lack of exercise. So you see how all of this helps you to minimize the risks of developing hypertension. All right. Smoking. Smoking is a risk factor for hypertension, because the chemicals in the smoking damages the heart, which puts more stress on the heart. So for you to remove that factor of smoking or smoking cessation, it helps you minimize the development of hypertension. Okay. For those of you who already have maybe pre-hypertension or moderate hypertension, you want to have a machine at home to monitor your hypertension, so that when it gets out, you're noticing a pattern of it getting out of control, then you rush to see your physician. All right. So have a portable machine at home to check your blood pressure often. All right. Especially if you do have a history of hypertension, you want to have a machine at home to monitor your blood pressure. Write it down, take it to your doctor. Let them see whether the medication they put you on is actually working. We don't want you to not take medicine, or even though you're taking it, but the medicine is not quite, the dosage is not quite working for you, and you're going about your business, and then you pass out somewhere. Please, if you already are on medication or hypertension and you have that fluctuation, you want to make sure that you have this machine at home where you're monitoring your blood pressure, just like someone with diabetes be looking at the blood sugar levels. All right. You do the same with your high blood pressure readings. All right. So you monitor this at home, which gives you a head start. It gives you a sense of, okay, when I need to call 911, or when I need someone to take me to the hospital, and how often you should visit with your physician to regulate your medication. And sometimes your medicine could start to work, then initially it plateaus, the effects of it plateaus, where it's not necessarily helping you anymore. You want to make sure that you're visiting your physicians frequently enough, often enough, that they can detect things like this, constantly adjusting the cocktail of your medications. All right. Then now we'll talk of medications. There are different kinds of medications that they will give you. They'll put you on ACE inhibitors. We mentioned it real briefly earlier. ACE inhibitors, diuretics, put you on diuretics. They'll put you on beta blockers. They can also put you on vasodilators. All right. So the medicine that would be used, the kind of medicine that would be used, or the brand, would depend on your medication, on your blood pressure reading and the history of hypertension. I said if it's a secondary factor that causes your blood pressure, removing that causative agent is the best course of management. If it's at a point where it's not even just a causative factor anymore, it's at a point where you need to use medicine, not just lifestyle modification or removing that causative agent, then you have to be on medicine. And the kind of medicine or the combination of medicine that you will be put on will depend on just how serious your hypertension readings are, how concerning they are. Because if it's too concerning also regarding the age, then I'm going to have to put that patient on 2 or 3 hypertensive medication, right? So let's stop right here. Stay tuned. See you in the next video. Bye-bye.